Now, what do we know about these aid drops today? What actually has been able to get into Gaza, and what's the plan going forward?
Yeah, well, it's like you started off with. I mean, I can say how much aid was dropped, but I can already start with what aid agencies are saying, which is that this is not nearly enough. We're still seeing deaths, 14 deaths just in the past 24 hours. That number is probably going to be increasing, according to Palestinian health officials in the Gaza Strip, which is ruled by Hamas. Two of those were children. Now, I was speaking to some aid workers and advocacy groups, and one of the reasons why, of course, and I think we all know this, that children are affected disproportionately. They need food. They need specialized food. They need high quality food. This is something that I heard from a member of Doctors Without Borders just today. And the hunger affects everything. So not all of these people are necessarily dying just because their bodies are completely depleted from a lack of food. It affects recovery from traumatic injuries, a lot of them sustained in these continued Israeli bombardments. It affects recovery from infections that come from the rampant and ubiquitous lack of hygiene in all of these different refugee camps, or displacement camps that people are being forced to live in, some well more than 90% of the population who have been displaced many, many times over. So it is something that really has a knock-on effect in terms of health. It also, and this is something we hear loud and clear over and over again, affects the doctors, the caregivers, the nurses, the emergency workers who are entrusted with providing care for everyone else. They are suffering. This woman that I was speaking with today from Doctors Without Borders, she said that she gets one meal a day. She's a foreigner. Her Palestinian staff will get a bit of rice. And most of them won't eat the rice because they have to go home and take it back to their children and family members who have nothing. So this is a situation that is going to be getting worse despite the fact that we are seeing this aid coming in. There's another issue here that a lot of these people who are suffering from severe malnutrition, that can't be reversed by simply giving them conventional food of the kind that we're seeing provided to families in the pictures you're seeing on your screen right now. Dried pasta, rice, olive oil. They need specialized food to reverse the devastating effects of severe malnutrition. So many of these people, we might actually see more deaths even after they are fed, particularly in the case of children who, again, need specialized care and attention when it comes to hygiene and nutrition. So this is something, again, just watching all of this aid come in, and it still is not nearly enough. As I mentioned, it is not going to necessarily have an immediate reversal effect on the devastating conditions that we're seeing in the Gaza Strip.
Matt Bradley, thank you for that. So, Bob, your folks are living this firsthand. They're seeing it, experiencing it firsthand. Babies who they have nothing to give but water, if that. And as Matt pointed out, doctors and nurses who are going hungry, concerned about their own families. Tell us what your folks are experiencing on the ground, and to what extent can this change make an impact?
Well, I can tell you that 1 in 5 under 5-year-olds are now facing acute malnutrition. That's a stark number, higher than we see in most other parts around the world. But what's more terrifying is that that number has tripled in 1 month from June to July. We've seen 24 under 5-year-olds pass away, sadly, in the last 3 weeks alone. Because of the causes of food and their systems closing down. The situation in Gaza has been degraded such that it's almost unlivable. So people are facing public health risks every single day. If you catch a communicable disease, diarrhea or something, against the backdrop of extreme hunger, your days are numbered. So my staff are telling me that they are going days without food themselves, and they are paid. So this isn't an issue of income. It's an issue of accessing food that's just no longer available on the market. Prices have increased by 700% over the last several weeks. So the situation is extremely urgent. And frankly, the airdrops, the humanitarian pauses, I would say are an inhumane distraction. The Gaza is surrounded by countries with aid workers, aid organizations, UN agencies with food ready to bring them in, but they are being blocked.
I want to go back to that in just a second, but Garrett, the president said today, and he said a lot. We're going to dig into it all, but I want to start with the fact that he has been speaking with Benjamin Netanyahu and says there are plans to open food centers for the people in Gaza. Is there a timeline? Is there an actual plan for that?
Chris, I think this moment speaks to the power of the images that have come out of Gaza. You heard the president reference several times seeing pictures on television of starving children and breaking with Benjamin Netanyahu over just the acknowledgement that the famine in Gaza is real. But in terms of his plan for these food distribution centers, they are as commendable as they are confusing. The president offered no specific timeline. He also didn't explain who we is in his construction when he says we will open these food distribution centers in Gaza and make sure there are no barriers to who can get the food. You can tell the problem he's speaking to, but not how he intends to solve it. There's obviously no U.S. military presence in Gaza. There's barely any U.S. aid group presence in Gaza. The president has feuded with the head of World Central Kitchen, Jose Andres. It's not clear if that's someone he'd want to work with. So it's a big promise from the president, Chris, with no specific details provided by the president then or the White House since about exactly how he intends to pull it off.
Richard, what do you make of the president breaking with Netanyahu over this?
Well, Chris, I think it's a good thing. But in terms of what Garrett was saying, what's the point of having leverage over someone if you don't use it? President Trump has supported Bibi Netanyahu in the bombing of Iran. He supported him in moving the U.S. embassy to Jerusalem. He supported him in many, many ways. But now he needs to make a bargain. The U.S. needs to flex its muscles in terms of having a lasting and durable ceasefire in Gaza, in making bus routes and truck routes for humanitarian organizations to deliver food, not just this artificial organization that Israel has come up with. So I do think the U.S. needs to use its muscle to create and solve a humanitarian disaster, which is a completely man-made disaster.
Well, Bob, the president also said that he'll be working with the UK on more airdrops. Take a listen.
We're going to be even more involved. We did some airlifts before, some airdrops, and the people are running for it. And the prime minister is going to help us. They're very effective with that. You've done that before, and for many, they've done that for 100 years very well.
Are they very effective, Bob? I mean, just yesterday, Palestinian health officials said that 10 people were injured. They were so desperate to get this food that they got hit by what was being dropped. And then they also point out that the amount of food that can be brought in this way is very small. Is this effective, or expand on what you were saying before about what really could get done?
Yeah, I would say that airdrops are one of the most ineffective, most expensive ways of delivering aid. We would only consider using them when infrastructure is so either broken or blocked that there's no other choice. And there are many other choices here. As the colleague was saying earlier, we can lift the barriers, we can lift the blockades here to allow the tens of thousands of tons of food that are waiting on Gaza's borders to come in. That will immediately start to ameliorate the situation. But politically, we're choosing not to, so we're reverting to what is a distraction, and it's an ineffective and expensive one at that.
While the president, it should be said, Richard, noted that he's been watching this on TV, that it is undeniable what we are seeing with our eyes. He also has repeatedly raised a concern that no one has come to him, no one has come to the U.S. and said, thank you. Hear that. Listen to that.
We gave $60 million. Nobody said even thank you. You know, thanks. Somebody should say thank you.
Do you have an idea of who that somebody should be?
Well, I mean, Chris, in my view, superpowers don't need to be thanked for doing something that is in the humanitarian benefit of other people. I'm glad that the administration has done it. I hope they give more. But I also think they should do more. They could organize a collection of countries, including Saudi Arabia and the Gulf nations, to try to solve this hunger problem. As Bob said earlier, these blockades should be ended. They're artificial. They're helping the Israeli military. The U.S., this is one of the things that America can do and has done well. It's one of the things that the UN has been doing for hundreds of years, and we need to, at least this administration needs to get over its reservations about helping the UN do its job in Gaza. Because as also Bob mentioned, there's been an unprecedented amount of casualties and deaths among aid workers, among workers for international NGOs, for UN workers, hundreds of them. That needs to be stopped as well.
I also want to say, Bob, and it was last Tuesday that I spoke to someone in country, well, in Gaza, who described the situation that now has escalated even more. And I do want to point out that not only do they have the heart for this work, but they do have some victories. And your organization, I know, I want to point out, was able to have help a 7-month-old baby get life-saving care through your emergency nutrition program. Is your message, I don't want to put words in your mouth, Bob, but that time is running out, but it's not too late?
Yeah, my message is that we have collectively a proven delivery mechanism that has worked in Gaza for decades. We, the international NGOs and the UN, know how to solve this problem if we are allowed. We have some funding, not enough, but we have the staff and we have the systems to deliver aid to the people that they need so urgently in a way that is accountable, that is not diverted, and in massive comparison to just dropping aid out of the sky that people can steal. It feeds the strongest rather than the weakest. So my plea here is to invest back in the system that works around the world and has been proven to work in Gaza. We know how to save lives. We just need to be allowed.